Today on COVID-19 Local Impact, progress made in Peterborough,
24 of our cases are now resolved.
a wake-up call from the Prime Minister,
We need to continue doing what we are doing now.
and Peterborough Mayor Diane Therrien addresses the fiscal state of the city.
There's a lot of uncertainty for residents, obviously, but as well for the municipality.
Welcome to COVID-19 Local Impact on Your TV. I'm Dan Malta from the Your TV studios in Peterborough. More promising feedback from Peterborough Medical Officer of Health, Dr. Rosanna Salvaterra, as she details the tempering of the curve in Peterborough at today's Peterborough Public Health Unit briefing.
So I'll start with a current case count. Peterborough has 53 confirmed cases of COVID-19. We've not seen any increase since Monday, but this amount is an increase of 8 in the past week. So what we've done is we've actually put our data in a curve. This is by onset date. And so what we're showing, if you can see down to the first case we had, March 2nd was the onset of those symptoms to today. This goes till April 14th. You can see that curve is not rising as steeply as it was a few weeks ago. We are still, as far as local transmission, we still only have 3 of our 53 confirmed cases where we have not been able to identify either recent travel or exposure to a contact. So that's still about 5% of our cases being local transmission. So that remains low, and 24 of our cases are now resolved. As you already know, we reported our first local death on Sunday. As far as how many people have been tested in Peterborough, we're almost at 1,400. The number is 1,393 have been tested. Of those, 1,133 are confirmed negative. And we have 207 under investigation. We have lots of swabs on hand. We have 355 testing kits available. We have no new outbreaks in a long-term care setting to report. And the 3 outbreaks that we reported last week are stable. They're being contained, and there have been no new cases associated with those outbreaks. As far as new public health measures, we have the province announced yesterday that it will be extending its emergency orders for another 28 days. And we have had updates made to directives number 3 and number 5, directed to public hospitals and to long-term care settings. So I just want to take a couple of moments to provide you with an update on testing for COVID-19. We've made great progress in increasing the access to testing over the past month. When we detected our first case on March the 12th, we had limited testing kits due to global shortages. We also had limited lab capacity and not enough access to test everyone who had symptoms consistent with the disease. Many callers were not offered testing and were advised to self-isolate for 14 days. So that is no longer the case. We are still only testing people who have symptoms outside of an outbreak in a facility or institutional setting where there are vulnerable residents. But anyone living in Peterborough City, the county, Curve Lake First Nation, or Hiawatha First Nation can call the COVID Assessment Center at PRHC to request an appointment for testing. Or they can call their family physician or their nurse practitioner if they are unwell. We have community paramedics that are able to take referrals from primary care or public health to do testing in the home, whether it's a private home or it's a group home. And the paramedics are also providing testing for people currently staying in the shelter system. The province has expanded the list of symptoms that may indicate COVID-19 infection. Nursing staff of long-term care homes and retirement homes are testing anyone now who develops any of these symptoms. And not only are the symptomatic residents being tested, but their asymptomatic roommates are also tested at the same time. If there is a positive result, asymptomatic contacts, caregivers, and healthcare staff are also being tested. We have capacity in the system now to provide timely diagnosis for anyone who needs it. Results for priority populations are usually being reported within 24 hours of the specimen arriving at the lab. And as of last weekend, the public health lab is ensuring that specimens can be delivered for testing 7 days a week. Speaking of the public health lab, Peterborough Public Health has now been asked to serve as a regional hub for COVID-19 testing kits. So we are currently in the process of assessing the needs of all our community partners so that we can order in enough supplies to meet their demand. This past Friday, the province announced its intention to significantly expand and enhance testing for COVID-19. Peterborough is ready. We are awaiting guidance on testing for specific vulnerable groups, such as immunocompromised patients, essential workers, and people living in congregate living situations or institutions. But in the meantime, we've been redirecting these callers to the assessment center for testing. Yesterday, local public health agencies like Peterborough Public Health were asked by our Chief Medical Officer of Health to identify additional opportunities to do targeted surveillance in long-term care settings. All of this is part of a much more aggressive case-finding approach. We are now ready to look for this virus in order to stop its spread even sooner than has been possible in the previous weeks. So with that, I'll turn it back.
We'll continue to bring you the updates from Dr. Salvatierra and the Peterborough Public Health Unit every Wednesday on COVID-19 local impact. Now we'll take a look at the numbers from around the region, not the ones from Peterborough and County, as Dr. Salvatierra gave those on her own, but in the city of Kawartha Lakes, 109 cases, 6 hospitalizations, 33 confirmed deaths, 29 of those deaths from the 1 confirmed outbreak in Bobcaygeon in Northumberland County, 14 confirmed cases with 1 hospitalization. With the recent announcement, the City of Peterborough has laid off 321 part-time and 5 full-time employees due to the coronavirus pandemic. Your TV's Mary Tendeshat speaks with Mayor Diane Therrien about the possibility of some staff being redeployed to work in city-run long-term care facilities. The mayor also comments about the possibility of running at an operating deficit this year, which is not allowed under normal circumstances.
I am not sure, and the province just changed regulations around folks working in long-term care facilities because people used to work sometimes in more than one because it doesn't pay as well as it should to do that really important and really difficult work. We have a report coming to the May cycle that's looking at those types of things, as well as, the lost revenue from having to close our arenas and other facilities. So we're not getting, fees and admissions from that. Moving into the summer, we're not getting money from the sports teams that would normally be paying their usage fees right now. So then on top of all of that, we've had the property tax deferral. So there's a lot of uncertainty for residents, obviously, but as well for the municipality, because we don't have that revenue coming in as well. So
has the city considered that it may run at an operating deficit this year?
So municipalities currently are not allowed to run deficits. So I know this is something that the province is hearing more about. The reality of us not running a deficit when we don't have any money coming in to cover the operations is something that, again, is quite unprecedented, but it's something that's going to, I think, have to be looked at.
What are the ramifications then for the city if it does have to run at a deficit?
Running a deficit this year, I think, is likely going to have to happen. And then it's, also a question of how long it takes us to climb back out and recover.
Mayor Therrien also provides an update on the plan to postpone the turning on of the Centennial Fountain.
having an attraction like that being on, I think is all, another part of it is that people would, go and look at it, and then we'd have a problem of people that aren't physically distancing down at Little Lake. So for all of those reasons, we've decided preliminarily, as you said, it needs to be ratified by council next week, to have the fountain remain off until such time as, these orders are lifted and we're able to go out again and hug each other and see each other. And, the idea that was talked about last night was perhaps there would be some kind of community celebration with music, and, we will get through this, we're coming together. So that gives somebody, gives something to look forward to, and hopefully we'll be able to do that later this summer. But again, there's so much uncertainty going on that we felt this was the right move at this stage.
Over the past week, the Ontario Together portal has secured 13 million surgical gowns and 200,000 respirator masks. Many companies are retooling their production to answer the call for PPE. Peterborough-Kawartha MPP Dave Smith says the coronavirus pandemic has pushed the Ontario government to rethink its trade partnerships with other countries and provinces.
I think it's a great opportunity for us. We've had free trade agreements with a number of different countries, but we don't have free trade agreements amongst the provinces in Canada. And this is demonstrating that we're relying on global supply chains. And we can't be in a position for things like PPE where we're relying on the goodwill of another country. We have in Ontario a massive manufacturing base that can be retooled and can provide Ontario with everything that it needs. We have an engine in Ontario that can provide all of Canada with everything that it needs. And this gives us an opportunity then to break down some of the trade barriers that we have between provinces and to re-examine where we're getting some of the product from. Should we be bringing some of that back into Ontario? And the answer to that is a definitive yes. Wherever we can bring that back, repatriate it, have people in Ontario employed, and make sure that Ontario is self-sufficient and that Ontario can provide those services and those products to the rest of the country of Canada, the better it will be for us.
Executive Director of the Peterborough Humane Society, Sean Morey, updates us on the Humane Society and its volunteers, as well as the launch of the Urgent Animal Care Fund. Here's his conversation with our Mary Tendeshat.
We've been closed for adoptions and fostering since the 27th of March, and we see currently we've got just over 30 animals in our center right now, but also another 35 that are out in fosters, whether they are either new puppies or kittens that we've got fostering for the current time until we can get back open fully again. We've seen a steady increase. Obviously, it's increased a bit. Obviously, we're still open for strays, abandoned, and urgent care animals. So that's obviously something that doesn't stop. We've been doing animal care and protection for the last 79 years, and we're still here. We're still doing it. That nothing has changed on that front from our business standpoint. So regardless of, we are an essential service, and we need to make sure that we are providing those services as we move forward.
How much room is currently available at the shelter?
We still have some capacity, and obviously we'll still be here to provide support to the city and county as we move things forward. Obviously, we're here to provide support. Like I said, we're not going anywhere, and there is some capacity that we have in here. But with kitten season coming around the corner and happening, we're starting to see some moms and babies coming in, and that will change as we go forward, and change quickly, without question.
I'm sure you're missing the volunteers and the work that they provide. How is your staff reacting to the current situation?
Yeah, the staff are doing an amazing job, and you're right, Mary. We rely so heavily on our community, and obviously our community volunteers. They're amazing folks and do some amazing things for us. And yeah, without question, there is a void that is happening within the Humane Society currently. But I do have to give it to our staff. They are doing a phenomenal job, especially from a care and enrichment standpoint. Obviously, as you know, even though the doors are closed to the public, the animals still need to be fed, they still need to be medicated, they still need to be cared for and loved, and our staff are doing a fantastic job in that front. And yeah, we're very fortunate to have such dedicated staff. And I mean, animals are such a huge part of our lives as humans, for us to be able to provide that care and love is, that goes unwavering and without any hesitation whatsoever.
As a result, you have set up an urgent animal care fund. Could you explain the program and as well how the public can help?
Yeah, so I mean, obviously, our facility, we are 100% based off of donations, right? So we had some major events that we had planned for this upcoming spring that have unfortunately been canceled due to COVID-19, and so this urgent animal care fund is an opportunity for our community to provide support to the Humane Society in light of us being closed. So without adoptions being available to be done, or these events, and including third-party events that our community usually puts on for us, obviously, as I said, animals still need to be fed, medicated, cared for, and loved on, and obviously funds are needed in order to make that happen. So we are, the Urgent Animal Care Fund is an opportunity for our community to provide those kind of supports monetarily at a time where we need to be closed and unfortunately can't see them or have them into the center.
How are people able then to donate funds?
Yeah, so if they can go directly to peterborough-humanesociety.ca, there's a donate now button right directly on our webpage, and they can help us out by doing so. And obviously the animals that are in our care today, as well as the ones that will be in our care tomorrow, are greatly in need of it.
Sean goes on to explain the fund is more of a proactive approach by the organization at this time, but this is a way to ensure the care for the animals carries on. As COVID-19 local impact continues on your TV, we'll take a look at some members of the Northumberland community who are trying to make a difference. Welcome back to COVID-19 Local Impact on your TV. I'm Dan Malta. A Coburg group known as Northumberland.io has been formed to create a local supply chain for the production and delivery of face shields. Your TV's Mark Rockburn finds out more.
This is an alliance. It's an informal, self-organized group of, like I said, makers and manufacturers that have come together, a group of volunteers to create a local source of production that we can guarantee to our community so that we can get those face shields donated to frontline workers, hospitals, essential services, emergency responders, and long-term care facilities and retirement communities in Northumberland.
So how did this group come about?
Yeah, so I think it came about relatively quickly and easily because we're used to working together. Partly through Venture 13, our Innovation and Entrepreneurship Center here in Coburg, and through the Northumberland Manufacturers Association and the network of organizations that are focused on innovation. We're used to working together, and this was a spontaneous thing. We just identified that we really weren't content to wait for external organizations and institutions to deliver those critically and urgently needed supplies for personal protective equipment. And so we got together, the usual thing that's happening in COVID-19, it's like Zoom meetings and calls and so forth. And really the driving force behind that organization of a supply chain, there's a retired manufacturing executive, industrialist here in Coburg that has a pretty incredible Rolodex and is very well known. And he played a pretty central role in expediting all of that and bringing us together.
How many can you produce a day, and how many are you up to currently at the day of this interview?
Yeah, great question. So actually we have a dashboard on our website. So we're currently at an average of 77 units per day. That's growing. And actually we're coming up to our first milestone of having produced our first 1,000 units. So actually to get here, we needed to work with healthcare practitioners and frontline workers to understand what their needs were. So we're actually also we also have an applied R&D program where we're optimizing the design and working with users.
Where are you currently shipping them to? Is it just specifically to help the people in Northumberland County, and who can get these?
Yeah, that's a great question. So we're focused, this is a community-based production supply chain for our community. So to receive face shields, you simply have to go on to our website, northumberland.io, and submit an order. And the recipient types, as I said, are hospitals, emergency responders, long-term care facilities, and retirement communities, and essential services. So we receive an order, and then we will evaluate, verify, and work to deliver that as quickly as we possibly can. But those recipients would be located in Northumberland.
To make this happen, what supplies do you need to make these face shields?
Yeah, the most efficient thing would be, if people want to help, is to donate to the GoFundMe. So that would go towards, for example, the filament that we would need for 3D printing components. But also, we have actually a call out on our website right now we pretty urgently need buttonhole elastic bands. So if anyone has a strategic reserve of those, maybe sewers and craftspeople and artisans and so on, if you do have that, please send us an email, hop on our website to the contact form and let us know. But I think, and then finally, another crucial piece of this is the thin form clear plastic sheets that are used for the visor. That's very difficult to come across, and any leads on availability would be appreciated.
Yesterday, we told you the story of the Northumberland United Way topping their campaign goal of $850,000. Today, we touch base with CEO Bobby Dawson and find out how the United Way has shifted gears to provide for those in need.
I think probably the most recent stories would be related to the COVID-19 response. We set up the COVID-19 Relief Fund, and although we've met our campaign goal, we will continue to raise funds for COVID-19 relief, because we know that the impact of this to our community partners is going to last well beyond any sort of quarantine or business closures. So we've gone into the community and we've said, can you help us? And they have, and they've come back, and we've raised $10,000 so far. We continue to bring in dollars, and those dollars go directly to programs and services in the community that need it most, urgent and emerging needs. And it's really anybody. They don't have to be funded partners, currently funded partners. They could be, as long as they have a charitable registration number, they can apply and get funds for whatever it might be. I got a phone call from someone working within the new shelter that has been put out at the high school. And they said, this is going to sound really basic, but people don't have gloves and they don't have underwear. So can you help us? And absolutely was the answer. And it always will be in times like this for United Ways to support the community. It's not always about program delivery. It's not always about, meeting basic needs. Sometimes it's about something really simple like a pair of gloves or, a cell phone for somebody to stay in contact with their family and friends, things like that. So we really are trying to be responsive. We absolutely are giving to those organizations that are meeting those basic needs like food and shelter and things like that. And then again, our community partners always go well beyond their mandates by providing tons of volunteer hours and community support and just being out there over and above what their normal work week would look like. And I think that's why it works so well in Northumberland County.
If people want to give and get involved in the COVID Relief Fund through the United Way, how can they go about doing that?
If you just go to our website, mynuw.org, you can follow us on Facebook or on Instagram. There's information sort of all over there. It's a couple of clicks and you can get to the donation page. Every dollar counts, like I said. And if you are a community partner who's looking for funding, there's a button on our website as well. It's not a convoluted process. It's pretty simple. And we're trying to meet the need as fast as we can and with as many donor dollars as we can. We continue to sort of evaluate the annualized funding piece. We will be sort of moving this train along. And letting our community partners know that have applied for annualized funding, what that looks like as of today. We know that might change depending on the needs of our community, but all COVID-19 Relief Fund dollars go directly back out into the community and to those that need it most.
Prime Minister Justin Trudeau has an upfront and strong message for Canadians regarding when the economy will start to reopen.
We need to continue doing what we are doing now for many more weeks. We cannot be in a rush to get things going again, because if we move too quickly to loosen all these controls, everything we're doing now might have been for nothing. We'll find ourselves in another peak just as bad as this one or worse. And it will be extremely damaging both to how Canadians feel, but also to our economy. That's why we are going to be extremely careful about any steps towards reopening the economy. It seems like over the past days, people are talking about, oh, when we reopen this, we'll do this, we'll reopen that. It's not happening yet. If we reopen too soon, everything we're doing now might be for nothing. We are making sacrifices. We're there for each other. We need to hold on still. And then, once we're ready, once we feel we're through, once the experts are telling us that we can talk about reopening the economy a little bit, we will take very careful steps and do that.
To help limit the spread of COVID-19, Parks Canada suspends camping, group activities, and events across the country until at least May 31st of 2020. This means every service and facility will be closed until further notice, including the lift lock system. Parks Canada will not be taking any new reservations until at least June 1st of 2020. All existing reservations set to take place prior to May 31st will be automatically canceled and refunded in full. We leave you with this to end today's show. People staying positive, people staying home, and we say thanks to those working on the front lines. We're all in this together. For Your TV, I'm Dan Malta.